Hi, my name is Monica Matamoros, and I did my research proposal on the use of antimicrobial peptides and platelet concentrates to reduce bacterial contamination. Platelet concentrates are the primary blood product associated with transfusion-related sepsis, causing acute, severe, often life-threatening complications. It is the second most common cause of transfusion-related deaths in the U.S. It is estimated that the rate of bacterial contamination in PCs is 1 out of every 2,000 to 3,000 units, with severe sepsis developing in 1 out of every 6 recipients of contaminated PCs. Current methods to prevent bacterial contamination are ineffective. So my research proposal wants to evaluate the bactericidal activity of various combinations of antimicrobial peptides in order to reduce bacterial contamination in PCs. The addition of AMPs can potentially destroy all bacterial pathogens present in the units, eliminating the risk for sepsis. My research would focus on the most commonly isolated pathogens of platelet concentrates, which are Staphylococcus aureus, Staphylococcus epidermidis, E. coli, Klebsiella pneumoniae, Pseudomonas aeruginosa, and Bacillus cereus. Transfusion of blood products has actually been used for decades to manage a wide range of conditions, including iron deficiency anemia, platelet function abnormalities, and sickle cell disease. Recipients of platelet concentrates um, specifically are often undergoing cancer treatments, surgical procedures, or organ transplants. And these populations are often immunocompromised, which makes them more susceptible to infections. And these infections can be it could be fatal in these individuals. Regulations, requirements, and screenings have been developed to reduce the risks of infection when transfusion blood products, which includes careful donor selection, laboratory testing, and pathogen inactivation, but these do not completely eliminate the risk. It is crucial that medical personnel identify transfusion reactions and immediately discontinue the units. Most facilities have a protocol for transfusion reactions, which includes the collection of blood products from the patient, gram staining of the blood product, culturing of the blood product in infusion set, and the immediate start of antibiotic therapy for the prevention of infection in that patient. The thing that makes platelets more susceptible to becoming contaminated is the storage requirements. So the AABB suggests that platelets be stored between 20 to 24 degrees Celsius with constant agitation for no more than 5 days. So this temperature is usually ideal for bacterial growth, and it encourages it, which makes it more likely that the product will be contaminated. Many methods have been suggested throughout the years to reduce pathogen load in these units, which include strict donor selection criteria, proper cleaning of the venipuncture site, and pathogen reduction technologies such as Sutherland treatment followed by UVA irradiation. But even this does not work against all bacteria. Methods have been proposed in the last few years to reduce and detect bacterial contamination after collection. And these include nucleic acid-based methods, PGD immunoassays, flow cytometry, and pH monitoring. The use of antimicrobial peptides, also known as AMPs, is a newer technology that has been researched in the past decade. So AMPs are both naturally occurring and synthetically made chains of 6 to 100 amino acids that have antimicrobial activity against a wide range of bacteria, viruses, fungi, and protozoa. Naturally occurring AMPs are actually produced by many of the cells in our body. This includes neutrophils and platelets, and it acts as a defense mechanism against infections. Synthetic AMPs containing long chains of RW repeats have shown to be effective against a wide range of gram-positive and gram-negative bacteria. RW with 3 repeats are considered to be the optimal length to provide the highest amount of antimicrobial activity with the lowest hemolytic activity. AMPs act against bacteria through interactions with the negatively charged lipids in the bacterial cell membrane. An increase in membrane permeability occurs when the peptide to lipid ratio in the bacterial cell exceeds a certain threshold, forming clusters that eventually lead to the cell's apoptosis or destruction. Various studies have been performed to evaluate bactericidal activity of AMPs both individually and in different combinations. The first study that I read about, the researchers used platelet concentrate units, PC units, and they spiked them with different bacterial strains. Then they also injected these units with single AMPs as well as AMPs in different combinations. And what they discovered was that AMPs used singly greatly decrease the bacterial load in the units. However, when you use a combination of AMPs, there's a higher decrease, a greater decrease in the bacterial load because these AMPs have a synergistic effect. What that means is that they work together to more effectively destroy the pathogens. The second study that I read about focused on one bacteria, which is Staphylococcus epidermidis, but they used 2 different strains. They used time-killing assays, and they did the same thing as the first one. They took the PCs and they spiked them with these 2 strains, and then they used a combination of AMPs and different PCs. And they actually took out a sample from each of the units at different time intervals, which were 20 minutes, 60 minutes, 90 minutes, 120 minutes, and 24 hours. At the conclusion of the study, they determined that after 20 minutes, there was a great decrease in the bacterial load, but after 24 hours, all of the bacteria was eliminated. My study seeks to find which combinations of AMPs are effective against a wide range of bacteria, not just one type. The bacterial strains that I would use, I mentioned earlier, and these will be purchased from the American Type Culture Collection Organization at grown at 27 degrees on nutrient agar or LB broth. These will then be transferred to tryptic soy broth with 10% glycerol and stored at negative 80 degrees for long-term storage. The peptides that I would use are PD3, PD4, RW2, RW3, and RW4, and these will be used in different combinations, which you can see on this table right here. And if you can't see it, just refer to the handout that I have attached. These peptides will be synthesized by the Centers for Biologics Evaluation and Research at the U.S. Food and Drug Administration Core Facility, or FDA. They would be reconstituted in a phosphate buffered solution at a pH of 7.4. Then they would be adjusted to a 10 micromole per liter concentration, which is the recommended concentration for bactericidal assays without affecting platelet concentrate quality. The platelet concentrates would be collected by the National Institutes of Health of Blood Bank, which is the NIH, and they ensure that all of the proper protocols have been followed for donor selection, sterility, and storage specifications. Once received, these will be stored at 20 to 24 degrees Celsius with constant agitation and will be used within 5 days of collection. A minimum of 77 PCs will be needed for this study, and each have to be 0.9 mLs. Then to conduct the antibacterial assays, we will have to grow each of the organisms, submit logarithmic phase centrifuge at 3000 Gs, and resuspend it in PBS to a concentration of 10 to the 6 CFUs per mLs. PCs will then be spiked with 0.1 mLs of each of the bacterial strain solutions, and then different combinations of AMPs will be added to each of the units as well. As a control, we will have units spiked with each of the strains, but no AMPs added. These will all be incubated at 20 to 24 degrees Celsius with constant agitation, and 0.1 mLs will be pulled out at different intervals, which are 20 minutes, 60 minutes, 90 minutes, 120 minutes, and 24 hours. And then there will be culture and nutrient agar. After this, the colonies will be counted at 18 to 24 hours. And to analyze the data, I will make 3 line graphs, which are similar to the ones shown on the data analysis section. The first one will show which combinations of AMPs are effective against each of the bacterial strains. The second will show the amount of bacteria remaining in each of the PCs at the different time intervals, and it will help determine the time required to completely eliminate the bacteria. And lastly, the third line graph, we have the which AMP concentrations are the most effective against a wider array of bacteria. And in conclusion, AMPs could be more effective at reducing and even eradicating the presence of bacterial pathogens in PCs than any other methods that have been proposed in the past. The addition of these peptides to PCs during processing and storage could possibly lengthen the life of the product and ultimately make transfusion safer for the patient. Thank you so much.